Hi. I'm here to talk to you about pleural mesothelioma and black lung disease prognosis. The prognosis of pleural mesothelioma is determined with not one but several factors. The detection of cancer at the early stage usually leads to a favorable prognosis and can have a vast impact on the expectancy of the patient. Mesothelioma, like other forms of cancer, tends to have seriously limited choices of treatment when diagnosed at a later stage, and prognosis is even compromised most of the time. Black lung disease is literally making the minor's lungs black and obtained from constant inhalation of coal dust. The effects of black lung disease are long-term and can even cause death. Factors: the general health condition of the patient is the most significant factor that influences the prognosis. Mesothelioma diagnosed at an early stage will be able to go through the treatments easier than those who are older, and those with existing conditions. According to studies, persons aged older than 55 are at a higher risk and are more likely to occur to men than women. The next consideration would be the extent of the metastasis. If the cancer has not yet metastasized to other parts of the body, patients are likely to have several treatment options that will help increase the person's prognosis. Poor prognosis are likely to be in patients that are experiencing difficulty in breathing, having chest pains, cannot carry out daily tasks, weight loss and high level of LDH. These are usually indications that the cancer is already on its later stages. Prognosis for patients who exhibit these symptoms is usually present from 6 to 12 months. However, persons who are not having these signs will normally have more than a year. Ways that may help improve prognosis. Stage I patients with pleural mesothelioma can opt for a surgery called extrapleural pneumonectomy. This surgery is only offered to patients that are generally in good health. The surgery will remove the affected lung and the lining of the wall of the chest, pericardium and diaphragm. For those patients on the latter stages with black lung disease, an attempt for pleurectomy can be performed to help increase prognosis. This medical treatment relieves the pain without having to cure the cause of the suffering, since it will control the buildup of fluids in the mesothelium or sac. This does not cure, but it can take the pain away and any pressure on the lung. Survival rate. As in other lung diseases, the back lung disease is also bleak and narrow. After the diagnosis, there are cancer patients who live for 5 years or even more. This is called the 5-year survival rate, and the survival rate for this is about 10%. There are more compelling stories about survivors that are living, and they are willing to tell their stories. This provides hope for other patients under treatment process. Since prognosis may differ depending on cell types, any patient can always hope for a different and longer life expectancy. Hope you found it useful. For more information, please click the link in description.